OGLEE in the house once again, once again. Thank goodness, thank goodness. You know, there used to be a saying that went, I want to hear it straight from the horse's mouth. And what that meant was that I wanted to hear it from the original source or a very reliable source. Now, on this coronavirus thing, I'm hearing a lot of things from American officials and American doctors, but I want to hear it straight from the horse's mouth. They've said that Italy has been one of the hardest hit countries with the coronavirus. I want to hear from an Italian.
Situation is very bad here, I would say. To give you an idea of the overwhelming number of patients we are taking care of, I can tell you that we had like 800 intensive care unit beds before the crisis. We have currently being treated in the ICU almost 600 patients, plus another 100 that have been discharged or died. So we've treated a total of more than 700 patients in less than 3 weeks. So this is a tremendous effort. We have opened new beds, of course, so we've increased our ICU beds capacity of about 50%. We have completely reorganized the hospital network. We have created a network of dedicated COVID-19 ICUs where we cohort and isolate those patients.
So, Doc, is it too little too late? Was your country slow in reacting to doing something about the virus before it hit? Tell me if you would, Doc. What is it like?
A bomb that explodes, and you're simply overwhelmed by an incredible number of patients. Maybe we should then enforce even more the containment measures.
So, Doc, what is the message that you want to give to us?
Message I want to give to everyone, to every country who could hopefully not, but has the chance of facing this, is that the most important thing is to teach people how to behave in these circumstances. Because if you do not stop the spread of the disease, your health system, no matter how good, how efficient, how modern it is, sooner or later will collapse because the number of patients is too high for the resources we have.
Now, Doc, so that the people understand, can you repeat that, please?
Most important thing is to teach people how to behave in these circumstances, because if you do not stop the spread of the disease, your health system, no matter how good, how efficient, how modern it is, sooner or later will collapse because the number of patients is too high for the resources we have.
Now, Doc, you all have locked down 60 million. Here in America, we have over 300 million. Are you saying that a lockdown is the answer?
So, for example, now, let's say that bars and restaurants are still open until 6 o'clock in the evening, but they might be closed completely, and people should work from home or even stay, let's say, home and not going out, avoid any crowded place. The point, what's terrible of this disease is that you actually have to limit personal freedom and you have to limit, the interaction between human beings. But this is too important. Otherwise, this is going to be a disaster for Lombardy, a disaster for Italy, a disaster for Europe, and potentially for the entire world. So we're living this now, and my mission is not only to take care of Italian patients, but also to tell other people in the world how to get ready for this.
So you say we need to get ready for this thing, huh, Doc? What would you say that this whole coronavirus thing is like?
This is actually like a tsunami.
Like a what?
Tsunami.
A what?
Tsunami.
A tsunami, huh? So that means like a whirlwind. So what would you say that they need to instruct healthcare professionals on?
How to properly use the personal protective equipment. Because as you know, there's a certain risk of infection among healthcare workers, and that's another big problem.
Now, as far as the population goes, what do you recommend?
Teach the population, have the population ready, because no one is ever ready to be locked in. So they have to know that if this is coming, And when you understand it's coming, before the bomb explodes in one small part of the country, the whole country has to react.
As we know, as you explained it, like a bomb, so it hit out of nowhere, right? So it caught you guys off guard. What would you recommend that hospitals do here in America, or anywhere for that matter? What would you recommend that they do, having seen this onslaught of this coronavirus?
Try to think of an organization of the ICUs, like create a network of ICUs where you can put those patients, where you can isolate those patients, and to be ready to improve your ICU capacity. Then hopefully not everyone will live what we are living here now. Even in Italy, I mean, there are several regions that have a certain number of patients, but nothing comparable to our region. I don't really know why. Probably we have a very high density of population, and people come and go from Milan a lot.
Now, Doc, you're definitely on to something when you talk about that population density. And that's a problem we could have if it comes here in America like it's come over there in Italy, because we have a lot of densely populated cities.
So that's probably one explanation, but it's very, very bad what we are experiencing here now.
Doc, is the average Joe out there on the street really taking this coronavirus thing seriously, you think?
Yesterday, we had a message on TV from the President of the Republic like a few days ago. Then we had a couple of messages from the Chief of the Government. And from yesterday, I think that people are actually realizing that something very dangerous is going to happen, and that how this will go very much depends on what people do, because you cannot stop this by increasing the number of ICU beds or buying new ventilators.
So I guess you're saying that for a country like ours, USA, America, who is so modernized, so industrialized, that all of the equipment that we can make right now is not going to do enough. Is that what you're saying?
How this will go very much depends on what people do, because you cannot stop this by increasing the number of ICU beds or buying new ventilators.
All right, so Doc, just in closing, tell me and tell the people, what do we need to do to survive out here?
The only way to survive is to avoid other people.
You know, sometimes people have to hear things more than once. Can you say that again, please, Doc?
The only way to survive is to avoid other people. The only way to survive is to avoid other people.
So there we have it from Dr. Griselli over in Milan, Italy, an ICU doctor. So he knows exactly what's going on. We got the word directly from the horse's mouth. Anyway, this is OGLEE, and I'll see you again.